Thursdays, we always talk with folks in the medical community. Today, Sarah Rivenbark here with us. We were just chatting. We're paying attention, Gabe, I promise. It's nice outside. Chance of rain. A community paramedic, we were talking about the differentiations between community paramedic that shows up in a 911 call, and you said that was something that we really wanted to stress. So if I'm at home and I have an issue and I call 911, I'm not going to see you.
No, sir. If you have an emergency, we definitely want you to call 911. But once you go to the hospital and you're in the hospital, whether that's an admission or through the emergency department, and you're identified as someone who could benefit from additional resources, a home visit at your home by a provider, then they put in a referral, and then we make contact and schedule a visit with you. And
you were very quick to point out you're not a doctor, but I had said that this seems like the old doctor shows up with a black bag and knocks on the door and makes a house call. You're going to come in and really let people know you're going to not check them out, but you're going to make them in a good situation as well.
Right. So we come in and we're, of course, going to do a physical assessment on them, check their vital signs, and tailor the physical assessment to their individual needs. But then we're also, in addition to that, going to make sure that they are safe in their home environment, that they have all the resources that they need to be healthy in the community. You were saying
3,000 calls you guys have had last year. How is this a long-term care? So if a nurse practitioner assigns you to me, how many times am I seeing you?
So it depends on you as an individual. Our patients that we follow up with after discharge from the hospital, we try to transition them home during that first 30 days, that first month. At the very minimum, you'll get about 1 visit a week from us. But if you need additional visits, we can certainly do that. It's really up to you as a person and what we feel you could benefit from. And then if we're seeing you for a different reason, maybe we had a referral from the emergency department case managers, has someone who might need specific education on medication compliance or something of that nature, then we would visit you more often in your home to help coach you to have a better outcome.
It's just another great extension of how good a facility we have here.
Absolutely.
And I've said this more than once, but when my wife was pregnant and we had children, with twins, had a little bit of an issue, we learned very quickly you don't need to go elsewhere. We've got a great system here right in town. We really do. We have a lot of support from the hospital and from the nurses, and I'm very fortunate to work with each and every one of them. Sarah, I appreciate the time. Thank you so much. We're coming back after this.